Did you know that a stroke can occur suddenly, often without any pain or clear warning, especially in older adults? For seniors, even the most subtle symptom could be the first sign of a life-threatening emergency. Unfortunately, many people ignore or misinterpret these signs, thinking they are simply part of aging or fatigue. But the truth is, recognizing the early signs of a stroke and acting fast can mean the difference between a full recovery and permanent disability or even death. If you're over the age of 60, or if you're caring for a senior loved one, this video could genuinely save a life. So, make sure you stay with me until the end, because what you learn today could make all the difference tomorrow. And if you find this kind of health information helpful, don't forget to subscribe to our channel for more life-saving tips every day. In today's video, we're going to take a closer look at one of the most serious and time-sensitive medical conditions affecting older adults, stroke. Specifically, we'll be discussing the early warning signs of stroke in seniors because when it comes to stroke, every second counts. The sooner the symptoms are recognized, the faster medical help can be provided, which greatly improves the chances of survival and recovery. So, let's get started by breaking down the 6 most important warning signs of stroke that you should never ignore. Number 1. Sudden numbness or weakness. One of the most common and serious warning signs of a stroke is sudden numbness or weakness, especially on one side of the body. This can affect the face, arm, or leg, and it often happens without any warning. For example, a person may not be able to lift one arm, or their smile may appear uneven because one side of the face has drooped. The weakness might feel like the limb has become heavy or hard to move, and the numbness may feel like the area has gone to sleep. This happens because a stroke reduces the blood flow to the brain, and the part of the brain that controls those muscles can stop working properly. When that happens, the body part connected to that brain area also stops working the way it should. That's why sudden weakness or numbness, especially if it's only on one side, is a red flag for stroke. If you notice this happening to yourself or someone else, do not wait. Call emergency services immediately, because fast treatment can save the brain from permanent damage. Number 2. Confusion or trouble speaking. Another serious and common warning sign of stroke is sudden confusion or difficulty speaking. A person who is having a stroke may find it hard to speak clearly, understand others, or even process simple information. For example, they might suddenly stop in the middle of a sentence, use the wrong words, or say things that don't make any sense. Their speech may become slurred, slow, or jumbled, even though they were speaking normally just moments earlier. This happens because a stroke can affect the language centers of the brain, especially on the left side, which control how we speak and understand words. It can feel frustrating and scary for both the person experiencing it and those around them. You might notice they can't follow a simple conversation, give strange answers, or look confused when spoken to. It's important to understand that this is not normal forgetfulness or aging. If this kind of confusion or trouble speaking comes on suddenly, it should be treated as a medical emergency. The faster a stroke is identified and treated, the better the chances are of recovery and preventing permanent brain damage. So if you see these signs in yourself or someone else, don't wait, call for emergency help immediately. Number 3. Sudden vision problems. A sudden change in vision is another important warning sign of a stroke, one that people often overlook. A person having a stroke may suddenly experience blurred vision, double vision, or even loss of vision in one or both eyes. This can happen very quickly, without any pain or warning. They may say things like, "It feels like a curtain came over my eye," or "Everything looks blurry or dark." This happens because a stroke can affect the areas of the brain that control sight. When blood flow to these parts is blocked, the brain cannot properly process what the eyes are seeing. As a result, even though the eyes are healthy, the brain isn't able to interpret visual signals correctly. Vision problems caused by stroke can be mild or severe, but any sudden change in vision should be taken seriously, especially in older adults. Don't assume it's just eye strain or tiredness. If someone suddenly can't see clearly, sees double, or loses vision in part of their visual field, it could be a stroke in progress. In such cases, call emergency services immediately. Acting fast can help protect the brain and reduce the risk of long-term damage. Number 4. Loss of balance or coordination. A sudden loss of balance, coordination, or body control is another serious warning sign of a stroke, especially in seniors. A person may suddenly feel dizzy, unsteady on their feet, or have trouble walking straight. Simple movements like standing up, turning around, or reaching for an object may become difficult or feel off balance. In some cases, the person may even fall without any clear reason. This happens because a stroke can affect the part of the brain that controls movement and coordination. When blood flow is interrupted in that area, the brain can't send proper signals to the muscles, which leads to a lack of physical control. If someone suddenly appears clumsy, stumbles while walking, or seems dizzy and off balance, especially if this happens along with other signs like slurred speech or arm weakness, it could be a sign of a stroke, not just fatigue or a simple trip. Don't wait to see if it goes away. Call emergency services immediately. Number 5. Severe headache without a known cause. A sudden, severe headache that comes out of nowhere, especially when there's no clear reason for it, can be a warning sign of a stroke, particularly a hemorrhagic stroke, which involves bleeding in the brain. This type of headache is often described as the worst headache of a person's life. It may come on very quickly and feel intense, sharp, or throbbing. Unlike a regular headache or migraine, this kind of pain usually doesn't improve with rest or medication, and may be accompanied by other symptoms like nausea, vomiting, dizziness, confusion, or even loss of consciousness. It's important not to ignore this symptom, especially in seniors. Many people make the mistake of thinking it's just stress or dehydration, but if the headache is sudden, intense, and unusual, it could mean that a blood vessel has burst or there is bleeding in the brain. If you or someone you're with experiences a headache like this, and especially if it's combined with other stroke symptoms like numbness, vision problems, or confusion, call emergency services immediately. Number 6. Facial drooping. Facial drooping is one of the most visible and well-known signs of a stroke. It usually happens on one side of the face and can appear very suddenly. A person experiencing this may find that one side of their mouth is drooping or they can't smile evenly. The affected side of the face may also feel numb or look flat and expressionless. A simple way to check for facial drooping is to ask the person to smile. If the smile is uneven or one corner of the mouth stays down, it could be a sign of a stroke. This occurs because a stroke can affect the muscles that control facial expressions, especially when the brain's blood supply is disrupted. It's important not to mistake this for tiredness or muscle weakness from another cause. Sudden facial drooping is a red flag. If you notice it, especially along with other stroke symptoms like slurred speech or arm weakness, take action immediately. Call emergency services without delay. Fast treatment can greatly reduce the risk of long-term damage. Recognizing the warning signs of a stroke like sudden numbness, confusion, vision problems, or facial drooping can truly save a life. Especially for seniors, every second counts. The faster a stroke is identified, the sooner treatment can begin, and the greater the chances of recovery with less damage to the brain. So, if you notice even one of these signs in yourself or someone else, don't wait. Call emergency services right away. Acting quickly can mean the difference between life and death, or between full recovery and long-term disability. If you found this video helpful, please give it a like, share it with friends and family, and subscribe to our channel for more important health tips focused on seniors and brain wellness. Your support helps us continue spreading life-saving information.